Voilà, nous sommes dans la dernière ligne droite, dans la dernière séquence de ce long colloque, et je vais demander à tous les intervenants de nous rejoindre pour effectivement, comme le dit Patrick Lévy, lancer cet appel de la Sorbonne, mais avant de le lancer, il faut encore le constituer pour une Europe de la santé innovante, attractive, bienveillante, essayer d'élaborer tous ensemble une plateforme de propositions pour l'université et la science de demain en Europe avec les rapporteurs des sessions. Alors, j'appelle Ariane Berdal et Laurent Chambaud. Je crois que Laurent Chambaud nous a quittés, mais Ariane Berdal est avec nous. Elle est doyenne. Elle est à l'UFR d'odontologie de l'Université de Paris, chargée de mission recherche de la conférence des doyens d'odontologie. Les rapporteurs de la session 2, Armel Drexler.
She teaches odontology at the University of Paris and also is in charge of research. Rapporteurs from session 2, Armel Drexler, Gilles Rode, and representatives from the students we heard, and rapporteurs from session 3. So we'll listen to you. I know that Frédéric Lagarce will have to go pretty soon. So maybe Frédéric, you can start with Patrick Lévy. We'll do it retrospectively, listening to the rapporteurs for session 3 first. I don't know if the other rapporteurs are with us. Gilles Rode was supposed to join us, and also the student representatives, Gaëtan Casanova, Pierre Lucas, Mathilde Renka, and Tanguy Guibert. So, Frédéric, yes. Hello, everybody. I'll try and sum up what you've heard in session number 3, giving you the highlights. Usually I have a little bit of time to put it together, so this is really off the cuff. Well, the take-home messages, so in this session, the point was to try and see how universities could ensure evidence-based medicine, rationality. So there was quite a lot of discussion. I'm not necessarily going to sum it up in the order in which they were discussed, but maybe topic by topic. There's a key word that emerged. It is training, education. So training students, training media, training scientists. So what emerges pretty clearly is that to have access to consolidated knowledge, there's a need for quality education, quality training for all stakeholders involved. And I mentioned training of students, scientists, and media, but this is also so that we may have informed citizens, and a number of speakers insisted on this. We talked about democracy, and Richard Horton also mentioned the difference between democracy and technocracy. What was picked up on by a number of speakers is that training and education is of the utmost importance. Since I have the mic and I'm not one of the speakers, I want to say that it's something we've observed at our university in Angers, and we're currently developing a degree to train media in evidence-based medicine and to train media in scientific culture. So I was delighted to hear what the speakers said. So that is the first aspect. Education, training is the priority. Second aspect, but most speakers, of course, used as an example the crisis we've just gone through. And the second aspect is the difference there was, the contrast between how quick the advance was in knowledge, which made it possible to have a vaccine very quickly, and all the back background noise there was with conspiracy theories and the reaction from the population faced with a number of events. What I remembered is the lack of comprehension, lack of understanding faced with a number of political decisions. And both Jean-François Delfrécy and Richard Horton actually noted on this. We have to understand that the time frame used by politicians is not at all the same as that of scientific advances. And Daniel Messager also picked up on that. Even when it comes to the media, there's a need to step back. So the question of time sequence. And we also saw that at the end of the day, the challenge that the crisis presented, we were able to meet from a scientific perspective and public health perspective, but it generated a lot of frustration in the general public, in the population, a lot of misunderstanding, and the time for explaining was not sufficient. And if we want society to make headway towards more rationality, more evidence-based medicine, and a notion of structured and consolidated knowledge, we'll have to better explain and better train, better educate. And a number of speakers insisted on that. The transmission of scientific information needs to be done properly and in an organized manner. And this is another takeaway message. The triangle, power, knowledge, and public debate. And he explained that it is when we organize these three poles the right way that we can get interesting results, interesting outcomes. So that's the take-home messages I have. I don't know how much time I have. I left out many things. I did it really off the cuff and right afterwards. Some interesting elements are the propositions by Véronique Préat to teach critical thinking more, and her proposal to encourage researchers that have public funds, public funding, to speak up in society debates in their field of expertise. I think that proposition is very interesting. It has some similarities with the American policy, which is that when you're paid by the American state, your publication should be open access, in open access. The idea is that since you're paid by the state, you need to give something back to society. I'll stop on this. If I may, two elements. The place of universities. It's been touched upon several times. I think one thing that is important and that wasn't said many times, but was said by our Belgian colleague, the defense of academic freedom. It is not only called into question in Hungary or in such countries. It can also called into question when what a doctor says is not received favorably by someone who disagrees. And if universities are a trusted third party, they can also be the institution that can put people back where they belong. And what Richard Horton said by Daniel Messager and by others, I think what is important is to stay in your role. So scientists should not talk as politicians, and politicians should not talk as scientists. And And the last thing, which is extremely important, and that has been insisted upon by Jean-François Delfrécy, is the question of how public health imperatives are discussed and considered in relation with individual liberties. It is not a trivial element. It is absolutely fundamental and will remain fundamental for the months to come. And I think we need to keep it an open question, but a fundamental question in our plea here. Well, I discussed it with Patrice Diot. So this is an off-the-cuff feedback, but you will work some more in the next few hours and the next few days so that we can publish a text. But I had the feeling and the impression that other academics agree in the room is that it's only the beginning. There will be other meetings in France, but also elsewhere in Europe. So it's only the beginning. There's one question I wanted to ask that it seems to me it has not been really handled. You say that universities need to embrace these challenges. It's a question. Is that to say that universities should play a role that they do not play for continuous professional development? Because the way I experienced it in universities, once you've finished your studies, you never go back. Well, lifelong learning in university is absolutely essential in all its components, in particular in healthcare. And we encourage students to come back to university for lifelong learning. And lifelong learning is actually mandatory for healthcare professionals. So since there are modules for lifelong learning, that can be more or less long. There should be multidisciplinary modules that could bring together journalists, politicians, because we talked about how important it was to educate politicians. And make the most of these lifelong learning modules to advance knowledge in scientific culture. What I haven't said, I'm at the head of the health group at Sciences Po, and they have a quality school of journalism, and I think they would be totally open to any proposals you may have for training modules, and that's probably true of many other schools of journalism. Maybe one other thing that Jean-François Delfrécy said, and I think the Conference of Deans might agree, setting up multidisciplinary universities in public health is absolutely essential because all these questions that we mentioned need to be anticipated upon. It would be really quite sad if, come the next pandemic, we were not better prepared. So a number of universities should set up these multidisciplinary public health universities. Could we set up an observatory of medical education? And I'll turn to Daniel Messager. Would journalists be willing to take part in an observatory? Because journalists always fear one thing, which is that we might put them in a certain organization with a view to regulating them, and they distrust all regulation organizations. Well, regulation authorities can be a problem, but when you see how the medical association regulates the way doctors talk in France, it is fairly limited. Well, if we do not have any further comments, we can move on to the second session. Many thanks to you, gentlemen. Second session. So I think Armel Drexler is not here. So, Gilles Rod, oh, apologies, Armel, you are here. It's because of the face mask. So, Gilles Rod and Armel Drexler, you are here. So, as rapporteurs of session 2. And at the end of our summary, we will put forward 3 proposals. Firstly, what Enrico Letta said, sorry, in a European health policy, what place is there for an ambitious project of health education? And we looked at the different views of the different speakers. And there's the question of well-being for students and quality of life and of students, and mobility around Europe should make it possible for students to get trained and educated, but it's also a way to contribute to well-being in their studies. And it seemed to be quite widely shared. The second challenge is the question of mobility and how to enhance it. We saw the figures given by the coordinator of the Erasmus Plus program and the very low number of students in the healthcare sector compared to other students. So is it not a necessity for faculties, universities to create the conditions to enhance that mobility for students in the medical and medical social sector? So there are different levers we can play upon. In European universities, the fact that incoming mobility is much higher than outgoing mobility, because foreign students come to train themselves in the clinical medicine, and because part of the training is of very high quality indeed in France. But faced with that mobility, there is a need for more flexibility of courses and to lighten the load of studies in France, which is a great impediment to mobility. A specific point for outgoing mobility for French students to go abroad is linguistic training. First and foremost in English for students who haven't had the opportunity to get a sufficient proficiency in English, but also in the other languages in Europe, Spanish and German, which is a limitation to outgoing mobility. How universities could set up schemes either themselves or in cooperation with others to facilitate mobility. Another challenge that was highlighted regarding mobility was to integrate residents that are in general medicine. Mobility is now for students who are in their 4th to 7th years. So we should facilitate the mobility for residents in general medicine, the possibility of a diploma in 4 years, but also for students who get trained in general medicine to come to France. With regards to values, and Sylvie Rotaillot asked the questions of what are the values for a European citizen to have. And the exchanges we had with students were extremely fruitful because they insisted on something that is probably essential in these shared values, which is that you can't do medical studies without critical thinking, and thinking has to be about the human being and the defense of human beings. So to sum up, I think there are 3 proposals that emerge from this session and this panel discussion. The first one has to do with strengthening mobility during 6th year of medical studies. The students will have validated their course of studies and will have time to go to other European countries to develop skills that will be totally in accordance with the spirit of the reform. And it correlates nicely with our second proposal, which is to foster reflection on harmonization of knowledge. The European guidelines will impose themselves more and more, but there is work to be done in harmonizing skills of medical students, mobility for work placements, and the acquisition of competencies. And finally, our third proposal would have to do with the students in the last cycle of studies for residents benefiting from the possibility that it might benefit from work placements in other teaching hospitals elsewhere in Europe. Using as a model the work placements across teaching hospitals in France. But of course, we would have to change a number of regulatory elements to make it possible. And now I'll give the floor to my colleagues so that they can complement what I've just said. Amel Drexler, did you want to add anything? Well, yes, because we haven't talked a lot about quality of life. In the panel discussion, there were not that many proposals that emerged, and we might have considered that quality of life can be enhanced during that year of mobility, but the proposals that we made with a view to going further than harmonization of diplomas, we know that a doctor can practice elsewhere if the degree they have, the diploma they have in their specialty is recognized in other countries. But European countries agreed on minimal requirements and on the content of training. And it is the question of content of training that blocks mobility, because people who leave are fearful of not getting their diplomas recognized. So we have to work on the content in work placement so as to develop competencies and skills. Thank you very much. Gaëtan Casanova, did you want to add anything? Thank you. Well, I have very little to add. Maybe just to give the opinion and speak with the voice of medical students. We asked ourselves why there is so much less mobility amongst medical students. And what we've realized is that there are lots of people who ask questions. Is it possible? Is that mobility possible? So we're a far cry from Erasmus scheme. You know, when I was a law student, we knew everything about the possibilities of Erasmus student. It is not at all the case in medical studies. So there is a cultural shift to be operated. The reform of the second cycle of studies should be an opportunity for that. It is about placing the healthcare professional at the center of everything. And And if we want that person to thrive and to realize their potential, mobility is a decisive aspect. And of course, there is such workload for medical students that they don't even think of asking about mobility options. If we worked on all of these dimensions, there is absolutely no objective reason to think that medical students are not as interested in mobility as the rest of students. So we have our work cut out, but I'm not worried. I'm optimistic. Did you want to add anything? Well, I want to speak on behalf of medical students in the first and second cycles, so first 3 years and next 3 years. What was recurrent is that the reform of the 3rd to 6 years could be something we could leverage to enhance mobility. And in the reflections we had, we thought it might be developed during the 6th year, because the principle, the rationale behind the 6th year would be to develop a career path for students who have different profiles, and mobility is a good way to nurture that variety of profiles. And the principle behind that 6th year is competencies, so we could actually focus on work placements around competencies, which is easier to engineer rather than with knowledge, because students are fearful of leaving because they think they might have to catch up on exams. Mathilde, did you want to say anything for ISNA IMG? Well, a quick word, because I think we're being too long. These were very interesting reflections on mobility in general and on the way that mobility can occur through work placements for residents in any specialty, in teaching hospitals or other hospitals. Those are models we need to give a lot of thought to, and we have to make it possible for residents to have work placements abroad, because this is something that potentially can be of interest for all residents. We talked very little about the prevention of psychosocial risks. There was a major project led by the Conference of Deans of medical universities on the prevention of psychosocial risks. There were questions that were being asked on a national scale on these topics. Are you in contact with colleagues from other countries? Is it something, even though we know that there are elements that are specific to France, Germany, or Poland, but having said that, do you think there could be exchanges as to what we want to try to do in towards a more a kinder training and education? Well, there's an association, European Junior Doctors, and we take part in it. We take part in the assemblies, but what is always difficult for that kind of organizations between students or young professionals is that quite often the poor cousin is the international aspect. So often we're often in touch, but we often mutualize information, and it's very important to do so. And one of the speakers, who was from Belgium, explained what was happening in Belgium and said he was fairly close to what you could experience in France. It's someone who actually had been in touch within my association, and my personal analysis was, isn't it strange that different countries experience the same problems? There must be a common denominator between all of that, and maybe the common denominator is the doctors themselves. Maybe I'm being a little bit provocative about that, about this by saying this. But so there's the National Organization of the training of healthcare professionals, but there's also a medical culture which might be specific for that profession in particular, and that medical culture too often has tended to value unnecessary pain. Because when we talk about working hours, and people tell you, but, oh, you know, back in my days, we worked 90 hours per week. It's a bit like, you know, people who say, well, you know, I drove quite often under the influence of alcohol. I never had an accident. So I think there's this idea that pain is being valued as though it were a mandatory step. It's a necessary step to be able to assume your responsibilities as a doctor. I don't think that's true. Well, I tend to think that it's through exchanges and discussions on a European scale, by listening to our counterparts in other countries, that we can improve what you call our culture. In the culture in the profession. And a very distinguished speaker said that it was a lot better to share a beer to feel European rather than watch Instagram. I forget who said that.
Ariane Berdal, would you like to report back on the first panel session? To reflect back on the previous statements made by the students, this idea of the students having to suffer, similarly to previous generations, takes on even more emphasis. So we need to move away from and break away the circle by sharing the notions of health disciplines at the European level. So it is important that we have consistency of definitions of the health disciplines and what it is about. Now, the panel session, as you've understood, in its first part, basically combine the various stakeholders, with everyone assessing the French context and the European context, assessing the weaknesses, the obstacles, and what possible solutions and responses we could come up with together. And on the institutional side, as well on the side of practitioners, the entire community draw the post-COVID lessons, and the tripod or triangle notion, which was mentioned in several sessions, push the political buttons, with policymakers and decision makers becoming aware of new definitions to come up with in the public health arena, with aging, with the notion of cost, with the accessibility of healthcare. This growing awareness giving health central stage and priority compared with the previous years. And what came out as well is the tangible benefits of research in the health arena. And we realized that the words innovation research, which are quite unifying in national France and in the European level, we heard Irene Norstedt said that it was innovation was an engine and a driving force for France and Europe. And we realize that there are lots of angles possible, and we realize that this world, which had focused its interest in understanding diseases and meeting the technological challenges has to see societal issues, social sciences, public health, journalism reinvested and reinjected. And the second lesson to be drawn from the post-COVID assessment is that, as many insisted, the fact that we needed to take on the European level, the national level, and the local level with respect to the networks, the multidisciplinary network which was to be developed and which was very much established in and anchored within the territories. So there is a European level approach with 5 pillars: prevention, participatory prevention, science and communication, and accessible, sustainable, and affordable. So the various authorities, the policy makers, and the general public has been working on 3 pillars, making the citizens at the core of the development process, boosting clinical trials at the European level, since we have high potential, comparing, assessing, and sharing best practices in the health systems in order to identify the upside and benefits for sharing. Now, European research communities have not waited for this symposium to focus on research and innovation. And there were success stories which were mentioned by a number of us, the ecosystems and practices focusing on the patients at the core of it all, with the One Health approach as promoted by Domenico Alvaro, the issues of cancer and personalized medicine. And Middleton, in his presentation of public health, which he gave in a very educational manner, identified those targets to be developed, including the non-communicable diseases, which account for 90% of the causes of mortality. So, on the institutional side, you've understood that it's a question of adding to the consideration to be given for health with the associated investments, and the institutional authority suggests that there is a change in paradigm which is effected to include and incorporate the innovation research centers into a more holistic approach to carry out investments, knowing that there is a weakness between the private network and the academic network in implementing and marketing vaccines. So we've realized that the industrial sphere can be improved with strategic funding injected into it, which will combine the European forces in sciences, in medicine, and in the economic sectors, carrying out investments and putting all this in synergy with our programs and amplifying the collaborative synergy. Now, with respect to field practitioners, you saw that this symposium was engaged by academics, hospital practitioners, deans. And with respect to field practitioners, what is the situation? Well, we have this timing factor. We've seen field practitioners being very much engaged, serving as a network of experts involved in many different activities of remarkable standing, which have been asking for a different timing factor, stabilizing some budget over the long term in order to have security over time. They've focused the future professionals that the current students are, with the need for attracting these new professionals, knowing that it is important that these future professionals be trained in innovation, be trained in their European identity. When there are European clinical trials, each member state and each hospital system need to be part of it, and there were obstacles identified in the hospital sphere with respect to spending and budgets. So what we are seeing here is that there is a strategy to fight the fragmentation. We should break down the silos, work horizontally in a cross-cutting manner, stabilizing the whole ecosystem. And what was of interest from the various stakeholders is that there should be a system to support obtain the European buy-in with active avenir systems that the hospitals and universities should be supported and assisted as well. And these are the conclusions of the symposium. Let us support everyone to move towards the European identity. It is great that you gave us this great summary, great job. It is now time for us to wrap up with Patrick Lévy, and Patrice Dio will meet us to wrap up this entire symposium. Okay, fine. This is difficult to wrap up and conclude such a dense, rich symposium. I would like to start by thanking a great number of people, and the list won't be exhaustive. We would like to thank the health conferences and the president of university conferences, to thank Ortus, Pascal, Victoire, and the entire team, as well as all speakers, thanking all participants as well who are still here and those who followed the symposium remotely, as well as the partner universities, because this is exactly what we wanted to achieve, to have a symposium with a number of universities, Leuven, Sapienza and Berlin, as well as Geneva universities participating and attending. Contrary to what Patrice Dio is possibly expecting, I will not engage in a general summary of what was said and what was heard. I would like to emphasize a few points. The few points which were emphasized are the European dimension of it all. To repeat what was said both by Véronique Trilenoir and Jean-François Delfrécy and the Minister Olivier Véran, that Europe braced itself and restored its footing and its standing and capacity against the pandemic. The crash test that Olivier Véran mentioned could be of importance for the development and the putting together of a European health policy and framework, because the member states and the European Commission were confronted with a dire difficulty, which they came out of with some success, with the possibility to draw some lessons, and knowing that there are very high expectations from European citizens, with 74% of European citizens considering that the European Union should have more powers and authorities with respect to health, and this should be surveyed more in depth in the various member states. So basically there are expectations from European citizens, and we heard a number of proposals today which are more or less advanced, some very much advanced. We spoke about the European health crisis preparedness agency, and Jean-François Delfrécy said it shouldn't be just an administrative or technocratic body, and that we should wish for an agency to be more operational. There are other initiatives which are important to build up the European Health Union as the European Agency for Health and Digital Technology, and we don't want Europe to lock on itself, even though it has to develop and build up its identity. There are two initiatives, or at least one initiative, which is the Lyon-based WHO Academy, which is of great importance. It is not a French-specific initiative. It is a WHO initiative with global ambitions and goals, but it is a question of training and educating the WHO staff and associated partners and stakeholders, and it's a good thing that France is involved in it by the simple fact that the headquarters of this academy is based in Lyon, in central France. I'm mentioning this because this was mentioned during the symposium, but also because one of the goals is that Europe, by reaffirming its identity, including the field of health, does not disconnect itself from the countries of the global south, as well as a number of partners and stakeholders. And the One Health approach, which was mentioned several times, is of great importance. There's no need to emphasize the fact that this dimension, which is human health and animal health, also involves a global world, a global planet. And we see today that we won't exit the current pandemic by not being concerned with what's happening in Africa, in South America, and elsewhere, because there is interdependency between populations, and this was clearly demonstrated. The second key point I want to focus on is about youth. We never emphasize this enough. I'm speaking under the control of young people here in this room. For once, a European symposium, a scientific symposium, focuses on youth, possibly more young students, but it's of great importance and it is critical. And on a personal level, I think it was a great success. It was very well demonstrated by Enrico Letta and by Danielle Cohn-Bendit with some brilliance in their speech. What is the takeaway message for us is that obviously Europe has ambitious goals focusing on youth. We spoke a lot about student mobility, which is of critical importance. We also mentioned the fact that in order for us all to gain better and stronger European identity, there needs to be a desire for Europe. So youth have a role to play, but it's not only youth who have to be convinced, but it is of critical importance. Several times it was mentioned that in order for us to have a desire for Europe, it's not just a question of training, education, innovation, and schooling, but there must be also having fun, partying, and drinking beers together. There's also the fact of sovereignty, which is at the core of the discussions and debates of the European Commission. And this notion of sovereignty is of importance. It is a notion which first and foremost challenges the member states and the public opinions in Europe. If we are to be realistic and practical and pragmatic, if we are loyal to our values, we can see that the notion of the strategic independence, strategic sovereignty is raised at the level of the European Union at large, and no longer at the nation states anymore. And it's not just vis-à-vis China and the US, but it is of critical importance for the European Union per se. And also something else was mentioned. We need to repeat this, that there is a responsibility for member states with respect to the need to build up a European Union of knowledge and health, which includes harmonization of diplomas. It shouldn't be just lip service. We need to simplify procedures. We need to make sure that European diplomas can be recognized across member states. Maybe not upfront, as Danielle Cohn-Bendit said, having all qualifications and diplomas recognized by everyone. But this must be the goal. If we don't do this, we won't go anywhere. My conclusion will be that the hope we can have, which comes out through our discussions today, is that the universities can engage in this transformation by being a trusted partner. Universities can achieve a lot in all the spheres which were mentioned, research, of course, as well as more multidisciplinary public health authorities and powers. We discussed training and education. It's not just student mobility, it's also mobility for apprentices, for other trainees, for other students, and universities, and this was mentioned, should play a key role. And finally, I didn't emphasize this so much because we had a full session with a number of proposals, but in the conversation which must happen between the citizens of Europe and science, the universities have a key role to play and should be a trusted partner, should play a greater role. The role it played was not enough, but the unprecedented situation we are under today requires this. And there is a political opportunity, which is that France will take up presidency of the European Union. The Conference of University Presidents came up with a number of proposals in these areas, and I believe that the Appel de la Sorbonne needs to link up with the French presidency of the European Union. Thank you very much. Patrice Dio, for your conclusion. Thank you, Patrick. for this brilliant and exhaustive wrapping up, which will have me conclude very quickly. We had a full dance day, some participating in this hall, others remotely from a distance in Europe and outside of Europe. It's just a step, a major step, of course, but I believe we've never had such well-structured, well-organized debates and discussions with such in-depth analysis on such topics as youth engaged in health-related studies, the need for restoring meaning and relevance to the notion of engagement, research, public health, the way we communicate on and about all this. This is a major step. It's not the last one. We'll need now to convert this trial by building up and building upon this Appel de la Sorbonne declaration around a few thrusts, around a few driving forces and key ideas which will make us go forward and move forward in this European health framework and policy. I came late when Daniel Cohn-Bendit took the floor, and the journalist told me when I was interviewed, asked me, do you really believe in the advent of a European health framework? And I said, yes, of course, because if we don't have a European health policy and framework, everybody will lose out for research, for innovation, for health at large. And I'm a staunch believer and advocate of a European health policy and framework, and will be working hard in the next few days. And I hailed the very rich participation, the very rich insight in a very attentive atmosphere and friendly atmosphere, and this is of importance. There was no beer. We didn't drink any beer today, but there was great pleasure in exchanging together today. And the next few days we'll be building up upon the Appel de la Sorbonne, which will have to be owned up to and embraced by the various universities which have to team up in Europe all together to push back the limits and advocate this European health union policy and framework. And thank you for your attention and participation. Well, I believe this is the end of it, the end of the end, the end of the conclusion. As Patrick just said, he extended some thank yous to the teams. Since you mentioned Victoire and myself, in fact, I would also like to thank you, Nicolas, Françoise, Fabienne, and the others. The teams under Olivier Madard, the Sorbonne teams, who were very much active, and I want to thank the teams of the CDD and the CPUs, the various speakers, the interpreters as well, who did brilliant work, and the interpreters, thank you back. This was not easy work, says the interpreter. We want to thank the interpreters, the participants, and the viewers in Europe who participated in this symposium. And I understood something, that the end sum is better than the sum of its parts. Thank you very much, and goodbye.